Hello guys, welcome to my channel. Today I'm going to discuss the topic gastric lavage. Gastric lavage is done in case of poisoning. This is done using a tube known as Boyle's tube or Evol's tube, and the parts of this tube are consist of a funnel, a rubber tube, suction bulb, mouth gag, and 50 centimeters mark. We have to insert the tube into the mouth of the person up to 50 centimeters and lower end. And we'll read about this indications, procedure, and the contraindications of gastric lavage. Firstly, indications. So gastric lavage have to be done within 3 to 5 hours of ingestion of the poison. Within 3 to 5 hours of poison intake. Ingested poisons within 3 to 5 hours. Injected morphine as it is secreted into the stomach. Poisoning due to salicylates and antidepressants. So these are the indications. Like in these cases, we go for the gastric lavage. And procedure. Firstly, make the patient to lie on the left lateral side or semi-prone position. Head should be hanging down over the edge of the bed, supported by an assistant. Remove the denture and ensure clear airway. Rounded end, this end, this lower end. Rounded end is lubricated with glycerin and tube is inserted carefully into the stomach up to the level of 50 centimeters. If the tube enters the trachea, patient starts coughing and bubbles are produced when the funnel dipped in the water. Actually, we have to insert this tube into the stomach. If at all this tube enters the trachea, then the patient start coughing vigorously. So by this we'll know that this is the wrong place, or tube has entered the wrong place. Now 250 ml of warm water or 500 ml of potassium permanganate is passed through the funnel. We have to remember this 1:5000 ratio, and contents of stomach are emptied and preserved for chemical analysis. Repeat the procedure till the colorless and odorless fluid comes out. This is what the procedure. And contraindications. The two contraindications, absolute and relative. Absolute in case of corrosives. If at all if there is a case of poisoning where he consumed hydrochloric acid, HCl, then you should not do this gastric lavage, because in case of the hydrochloric acid and HCl, all the stomach will be eroded. So we can't do gastric lavage. All the stomach will be burned, all the mucus is burned out. So we can't do this gastric lavage in that case. So it is an absolute contraindication, that is corrosives, that is H2S1 and there's exception for this. The exception is carbolic acid. So we have in contraindications, we have two, absolute and relative. In absolute, it is corrosives, but there is an exception, that is the carbolic acid. Means in case of carbolic acid poisoning, we can go for the gastric lavage, even though it is a corrosive, but it's an exception. Examples of corrosives are H2SO4 and HCl. And in relative contraindications are in case of children, or in case of convulsions, or in case of coma. We should not do this gastric lavage. Gastric lavage, yeah. Thank you guys. I hope you like this video.